Hi, I'm Aniela Amio, and I'm a Pilates teacher and a PTA at the Orthopaedic Therapy Clinic in downtown Toronto. And today I wanted to talk about your neutral spine and pelvis, which is something that you may have been asked to do in one of your exercise programs, either in your core work, your bridges, even some of your lunges or some of your standing positions. But I want to make sure that you can find that and feel it in your body when you're doing these at home unsupervised. So the easiest place to feel that or learn it is laying down on your back, because you have a little bit of the ground touching your body and giving you a little bit of feedback. But before we get down there, let's just go over a couple of things. Flexion, maybe flexion is good for you or not good for you depending on your injury, but flexion is a forward rounding of your spine, either in the upper back or even including the lower back and pelvis. And then there's extension, an arching position of your back. So you may or may not be doing those in your program, but you want to be able to find if you are in one of those by mistake by using a few bony landmarks. So bony landmarks are exactly that, places on your body that have bones. So we're going to find our ASIS first, or what we call our hip bones in most of your exercise programs. So on the front sides of your pelvis, you want to palpate or feel those bony landmarks. Your rib cage, anywhere through here, you want to get your fingers in there, because we're going to be doing fingers on your hip bones and thumbs on your rib cage so that you can feel the distance between the two. And then it's good to know where your pubic bone is, which is the bone down on the front of your pelvis where the two halves come together. So we have ribs, hip bones, and pubic bone down on the front. So let's get on our mat and we'll play with neutral pelvis. Okay, so here I am on my back in my neutral position. So neutral position is when your hip bones and your pubic bone are level to the ceiling and floor or level to one another. You have a small arch in your lower back and your ribs are down and your neck is comfortable. For some of us, like myself, I need a pillow underneath my head so that when I'm down, my chin isn't higher than my nose and my neck isn't too extended. So you might need to check out putting something under your head to feel more comfortable here, but then also notice now that my nose and my chin are more level and my ribs are actually back down. When I didn't have the pillow, my ribs lifted up. I got a bigger arch in my back, which for you might be a no-no. Okay, so I'm back in my neutral position here. Hip bones, pubic bone level to the ceiling and floor. And I'm going to know when I'm moving my limbs if I'm staying in neutral position by feeling my hips and ribs and measuring this distance or this waist length, so that if I were to accidentally flatten my back or move into flexion, do you see how my waist is shortening here on the front when my back flattens? Or if I was moving into extension, see how my back does that big arch, my waist actually lengthens on the front. So your hands can be used to develop proprioception, or that feeling of where your body is in space. And once you've gotten better at playing with this, you can take your hands away and get better at doing this in standing, on hands and knees, in your plank, in a side plank, doing any movement that might call for that stability in your spine. But for now, I can use these hands to make sure that when I'm moving my limbs, I'm not moving through my spine. Even something like a bridge, I'm not going too high and extending my back by lengthening this distance. I know that if my fingers need to be here, oh, I don't want to go any higher than this because I can feel that it wants to open. So now I'm just hinging at my hips and I'm not involving that movement of my spine. It's stable. So practice this, and if you have any questions about whether you need to be neutral, flexed, or extended, or if you need any modifications, reach out to someone on our team and we'd be happy to help keep you moving and keep you safe.